Multifocal atrial tachycardia. Multifocal atrial tachycardia is very similar. As a matter of fact, it's a variant of wandering atrial pacemaker. One of the big differences, though, is rate. Wandering atrial pacemaker will only have a rate of up to 100 beats per minute, but with multifocal atrial tachycardia, your rate's going to be 100 beats per minute or greater. But they're both going to follow the same rule in the fact that they have to have at least 3 different P waves of different morphology on the 6-second strip. So our objectives: compare and contrast MAT to WAP, describe the origin of MAT in the cardiac conduction system, and recognize MAT on an ECG monitor. So multifocal atrial tachycardia is a rapid supraventricular tachycardia that is caused by at least 3 different ectopic atrial pacemakers. The rate is usually between 100 to 150 beats per minute. However, sometimes rates as high as 250 beats per minute can occur. Differentiating MAT from a wandering atrial pacemaker, is essentially going to be consideration of the overall rate of the rhythm. If the overall rate of the strip is over 100 beats per minute, then it's MAT. If the overall rate of the strip is less than 100 beats per minute, then the rhythm is wandering atrial pacemaker. It is an irregularly irregular rhythm, and 3 different P-wave morphologies and PR intervals have to be observed, and it's got to be a rate greater than 100. Now, sometimes fusion and buried P-waves are very common because the rate's going so fast and because the conduction's all over the place. And then sometimes aberrancy or a conduction pathway outside of the normal pathway is very common as well. So this is an example of a MAT where you've got each pacemaker here is represented by a different color, and you've got a rate greater than 100. And if you notice, you have different morphologies of P waves, and as a matter of fact, you've even got P waves that have combined in with the T waves. It's very commonly seen in patients with chronic lung disease. Your best treatment strategy is going to be to treat the underlying cause. So respiratory issues, COPD, electrolyte abnormalities, these are all things that can cause it. So looking at a couple examples here, this one, so just like following the rules of WAP, we see that we've got different P waves. We've got at least 3 different P waves, and we've got a rate greater than 100. So in this case, you've got multifocal atrial tachycardia. Same thing here. You notice that these P waves, they all look very weird. They don't look like a sinus P wave because they're not. They're coming from a different area within the atria. This one as well, you can see the different P waves, and you'll even notice that you've got different PR intervals. And if you notice, it is very irregular. This one's a little more regular, but it is irregular. It's a little easier to see though, and you've got fusion of P and T waves. This is an example here, but you've got different P waves across the board. So on this one as well, you notice that it's irregularly irregular. And again, this one, I might could see where they say, hey, it confuses it with atrial fibrillation. But again, you've got definitive P waves. You won't have definitive P waves in atrial fibrillation. Again, you've got a rapid rate, and you've got P waves of different origins, and it's irregular. So again, it's multifocal atrial tachycardia.